Hey everybody, this is Dr. Brady from Kalkstein Chiropractic, and I'm here with the one and the only Christian.
How you doing?
Christian, how are we feeling today?
Feeling pretty good.
Yeah?
All beside this knee.
Okay, tell us a little bit about it. What's going on?
So I play a lot of volleyball throughout the week, and I feel like the repeated impact on the ground from lifting off and hitting the ground after blocking and spiking and stuff like that. I feel like there's just a lot of pressure in my knee, especially when I wake up in the morning. Kind of got to stretch it to loosen it up, but pops throughout the day.
Does it actively hurt while you're playing volleyball then?
I don't feel it really in the moment while I'm playing, but it's more of after I get out of the car on the way home.
Okay, that's when it tightens up for you then?
Absolutely.
Okay, gotcha. So Christian here has a knee injury on his plant leg, the one that you jump up with, right, Christian?
Yep.
Okay, and then you also land on that knee as well?
Absolutely.
Okay. Do you mind giving us a little tutorial of how you swing a volleyball here?
Step out.
Yep. And then you just land right through there. Okay.
Absolutely.
All right, so one of the first things that I want to do if you come in with knee pain here is to make sure the soft tissue structures, ligaments, and the joint here is all intact. So rule out any red flags before we get treated here today. Okay, Christian? So
sounds good.
Go ahead onto your back here for me, please.
Yes, sir.
Now, Christian, how long have you been playing volleyball then?
I actually picked it up in 2020 after the pandemic.
Okay.
I started playing in the Volleyball rec leagues in Baltimore.
Okay.
And it was took off from there. Met a lot of great people and found a lifelong passion in there.
Volleyball is one of my favorite sports growing up too. I started late as well, probably junior year of high school is when I started playing.
Nice.
Yeah, you're right. It's a lot of fun. So one of the first things I want to do, I want to check the major ligaments of the knee here. So I'll do PCL. What I'm doing here is I'm stabilizing Christian's foot here. And then what I'm doing is I'm putting all my force posteriorly. So if there is any injury to the PCL at all, what would happen here is his lower leg muscles, the tib and the fib, would be translating access more than usual here, okay? And then I would test for the ACL as well, so same thing except pulling in the other motion here. So I'm going to see if there's any excess motion anteriorly. So with Christian here, good thing is it's intact, really not getting too much movement for those two ligaments there, okay? Next, going to check the medial and lateral ligaments here by just doing some stress tests. Any pain or discomfort there?
None at all.
And again, no excess movement here in the medial or lateral motions. No pain or discomfort?
No, sir.
Good, awesome. Next, just doing a few other orthopedic tests. Any pain or discomfort as I extend and lower your lower leg there?
Nothing
no?
there.
Good. Can you go ahead and flip on over here for me, please?
Absolutely.
Next, I'm going to check out the meniscus here for that left leg. So Christian, what I'm going to be doing is I'm going to add some compression here. And I'm going to rotate your leg. Any pain or discomfort here?
Nothing there. Feels like a good stretch.
Good stretch? Okay. So basically this one, when I'm rotating outward like this, I'm putting tension or stress on that medial meniscus. And the good thing about this test here, I can test the lateral meniscus in the same position. So again, compression right here, rotating inward, putting stress on that lateral meniscus. If there is injury or strain to that lateral meniscus, Christian would be like, ah, screaming, which he's not right now. Feel pretty good, just like a nice stretch there, Christian?
Yep.
Okay, good. So just in this few minutes there, ruled out any major structural damage to the knee. Then I would start looking into the joint itself and the soft tissue structures surrounding that knee. For video's sake here, I'm going to treat Christian as if it's a sprain strain type of injury for his knee. So the soft tissues, the quad and the hamstring. Might dig into some IT band as well there.
Sounds good.
Get some needles in you, and then show you the cool new shockwave machine. All right, Christian, so can you point for the audience here where you're feeling the majority of your knee pain when it arises here?
When it arises, I feel it towards the top of my knee and a little bit back here, especially in the day when it pops, when I go down into like a squat or something. Sometimes it'll pop and it'll just kind of hang out back here.
Okay, gotcha. So you'd say it's worse behind the knee?
I would say that, yeah.
Okay, gotcha. So I'll start on your quads here and show you. You're going to help me out here. As I'm pinning down the muscle, you're going to go through some motion here.
Okay.
So what I'm doing, I'm getting into all four quad muscles, and I'm also going to the junction where it turns into that patellar tendon. Let me know if it's ever too intense here, Christian.
Gotcha.
So this is your starting position here, and then your finishing position is going to be bringing that heel all the way back as far as you can go. Kind of like a hamstring curl, okay?
Gotcha.
So there's your starting position there, and then go ahead slowly bring that heel back as far as you can go.
Good.
And just keep repeating that same motion there.
Gotcha.
All the way up. Yep. Good. And then all the way down. Doing okay with that pressure right through
Oh,
there,
yeah,
Christian?
feels good.
Good. All right, so let's talk Halloween costumes while we're doing a few passes here.
Oh, nice. I'm trying to decide between a knight and a Viking,
Okay.
and it's tougher than you might think.
Are you leaning one towards the other then? Or?
You know, I'm thinking more knight than Viking.
Okay.
I feel like there's a lot of ways you can go with the knight costume.
Yeah, because there's like a scarlet knight, there's a golden knight.
Dude, there's so many colored knights, dude.
And I was going along, as you could see Christian's face, I was getting deeper and deeper into the tissue. And then next I'm just going to work that lateral muscle out, that IT band, because it attaches all the way down to the knee here. Christian, you're really good at rolling out and stretching before and after volleyball, right?
Foam rolling is necessary.
There you go. All right. And then what I like to do is some stretches with the hamstrings here. All right, so Christian, what I'm going to have you do, you're going to push in and try and knock me down, okay?
Gotcha.
So what you're going to do, push in as hard as you can, try and knock me down, and we'll do it for 3 seconds at a time, okay?
Gotcha.
So go ahead and push in, knock me down. 3, it's harder than that. 2, 1, good. And then relax. What this is doing here is tiring out and activating that muscle. So when he relaxes, I'm able to go a little bit further and further here. So go ahead and push into me again here for 3 seconds. 3, 2, 1, good, and relax. There we go. All right.
That's interesting.
Push. Yep. 3, 2, 1. Good. And relax. Make sure you're breathing here too. Yep. And then just hold it. Just relax through here. Were you a gymnast when you were growing up? Any dancing or anything like that?
No. I think I used to jump from couch to couch in a Spider-Man costume as a child. That's
Okay.
as close as I got.
Well, there you go. Is Spider-Man on the list, or did you already been there
dude,
doing that type of thing?
Oh, dude, I've been Spider-Man probably about 4 Halloweens
Oh, okay.
in the last like 8 years.
Exhausted. All right. So go ahead and flip on over here for me, Christian. Speaking of superheroes, got the Incredible Hulk here today. Yeah.
Always got the best socks in the building, undoubtedly.
Let me get some soft tissue cream. Now I'm going to be working that hamstring and behind the knee there. Okay. So similar to the quad muscle for the pin and stretch technique that we use here, but instead of starting in that extended position, you're going to start in that flex position there, Christian.
Okay.
And you're going to extend. So that's going to lengthen all those hamstring muscles.
Gotcha.
Okay. All right. So bring that heel to your glute there. Yep. And then go ahead, nice and slow, all the way down. Good. And then back up. Good. And then down. Doing okay with that pressure there?
Absolutely.
Good. And now I'm going to do the medial tendon. And then one more. Yep, go all the way down. Yep. And you can relax through there. Alright, so you're going to feel all this way, all this into the hip here, ankle and knee. Good. Same thing through here. Good. There's this adjustment right here in the back of the knee here. Just a quick flick. Pressure, pressure, pressure. Good. Good. And I'm going to bring you on up. And now you should be hitting 10-foot line now, okay?
Oh, absolutely.
Get like 4 inches to your vertical there, alright? Nice.
Gotcha.
Alright, and then we would do dry needling and then couple it with shockwave therapy. Okay? Well, anything else I can do for you today, Christian?
That would be it, sir.
All good? Alright, well, yeah. Appreciate it. And yeah, follow us, like and subscribe. Alright, welcome back everybody here. Christian just got finished up with the dry needling here. The hamstrings, IT band, and a little bit into the gastroc and soleus here. So next phase of care here for Christian is our new shockwave therapy. It's a disruptive tool that we use to break up any tension or those trigger points that Christian may have in that hamstring, just from spiking, killing, and blocking. So Christian, I'm going to get started right through here, okay? Let me know if it's ever too intense.
You got it.
So just like the dry needling and the soft tissue work that I've done here, I'm getting into Christian's hamstring group. I'll do medial and lateral, and then I'll kind of work it down into that gastroc and soleus. Good intensity for you there, Christian?
That's great.
Last year you told me that I was going to be Tinkerbell for Halloween.
Are you gonna?
I'm not busting out this year.
I want to see you in a Tinkerbell costume. What are you gonna be?
A Ninja Turtle.
Oh wait.
Yeah.
Which one?
I think I'm going with Michelangelo.
You have a Michelangelo type energy.
Do I?
Yeah.
Is that the
Green.
green bandana? Purple?
No, those are green.
Alright, Thanks for watching, everybody. That's how we would treat a knee sprain strain injury here at the office. Christian, you have anything else to say here for the audience here?
Nothing much. If you come here, you're in fantastic hands.
All right, until next guys.